If your physician prescribed a medication to you that came in a Topi-CLICK Perl Dispenser with a vaginal applicator, it will look like this. These dispensers hold creams that are intended for vaginal use. Either your physician or the pharmacist here at Innovation Compounding have selected to dispense your vaginal cream in what is called a Topi-CLICK Perl Dispenser. Perl stands for Precise, Easy, Reliable Loading. The Topi-CLICK Perl is an FDA-registered Class 1 metered dose device, which allows you to easily and accurately measure out your dose each time. It consists of a cap that opens on a hinge, under which is a receptor port. This is where your plastic applicator will snap into. It also has the main body with a base that turns, like a deodorant stick. Each click or turn of the base dispenses approximately 0.25 milliliters of cream on average. This may change depending on the density of your cream, so be sure to read your label carefully as to how many clicks you are to be using per dose. The pharmacists here at Innovation have made sure that you are getting the exact dose your doctor prescribed by measuring the amount of cream per click and placing that on the directions of your label. You should be able to hear, see, or feel the clicks as you turn the base of your dispenser. Also note that there is a refill badge on the dispenser. Once the bottom of the dispenser gets to that point, you have a few days left of medication and should call us for a refill. The dispenser is made of FDA-grade materials, is BPA and phthalate-free, and blocks greater than 98% of UV rays. Once it is empty, it can be recycled using code number 5. Check that you have a vaginal applicator included in your prescription bag. If the medication is meant to be applied to the vestibular, vulvar, or labial region, you may not have an applicator included. The applicator should be contained in a plastic wrapper that should be removed and discarded before the first use. Notice that the applicator has two parts, the barrel and the plunger. The plunger should move freely within the barrel. Notice the rounded tip at the end of the barrel. This helps with comfortable application into the vaginal canal. The applicator can be taken apart and should be thoroughly cleaned after each use. To do this, simply pull the plunger from the barrel and wash with warm soapy water and lay out to dry. The applicator is also dishwasher safe for up to 30 washes, but take caution not to avoid residual medication transfer when cleaning. Reassemble before next use. The applicator can also be recycled using recycle code number 4. The most important step to properly applying your medication is to take a look at the label on the applicator. Make sure your cream is still appropriate by checking the beyond use date. If today's date is beyond that date, it is best that you get a refill of your prescription to ensure the highest quality product. Also, make sure you know the dose of medication your doctor prescribed and how often to take it. Depending on your condition or situation, directions can range for each patient. It is important to wash your hands thoroughly before applying the medication so as not to spread bacteria to the vaginal area. Some patients and physicians prefer not to use the vaginal applicator, but to apply the medication digitally or with their finger. Ask your physician if you prefer to apply it this way. To begin measuring your dose, flip open the Perl shell cap by pressing your thumb underneath the lip of the cap. Make sure your device is primed, meaning that the cream is all the way to the top and ready to use. Although we do this before your medication leaves the pharmacy, it may settle with transit. To prime your device, slowly give it a click until you see the cream at the top of the port. With the device in one hand and the applicator in the other, place the applicator on top of the receptor port on the top of the device. You should hear or feel a snap as the applicator snaps into place. Make sure the applicator is securely fastened on the top of the device so the cream does not leak out. You do not need to screw or force the applicator onto the receptor port. Next, simply turn or click the base of the Perl to load the metered dose into the applicator. In this case, let's use 4 clicks. In most cases, is equal to 1 gram. You will notice the plunger slowly rising out of the other side of the barrel. You will notice that your correct dose will be here at the base. A good rule of thumb to remember is that 1 gram is about a thin line of cream, the distance from the crease in your first finger to the end. This will give you an idea of the size of 1 gram. Of course, this is not a perfectly accurate measurement, but it helps if you prefer to use your finger to apply the medication. Once you have completed all the clicks that your label states for your dose, slowly tilt off the applicator until the applicator releases from the port. The amount of cream in the applicator should reflect the dose stated on your label. Remember to flip down the shell cap tightly in between uses to keep the medication from drying out or leaking. At this point, you will continue with inserting the cream vaginally. See our video titled Vaginal Applications, Inserting a Medication Vaginally for more information on how to insert the cream.